Hi, welcome to Betty on the Go. I'm your host, Betty Gudel. We're live streaming here at the Accelerator 720 Willette, and today I have a fantastic co-host, Violet. Our guests today are the ladies from amothersblessing.com, Janine Cook and Rachel. Welcome.
Thank you.
Thank you.
So, postpartum depression is huge with women. I've read studies that 80% of women go through postpartum depression after delivering a baby. So what kinds of things can help a woman what can prevent postpartum depression?
Actually, the statistics are 20% are if they're teen mothers. The statistics say that 20% of them will suffer from postpartum depression, and 12 to 16% of mature women who have babies will suffer, and you're more likely to suffer from it if you've had it before, if you're lacking support.
You've had any other kind of mental illness, like any kind of depression, bipolar, you're more susceptible to it,
yes,
right?
any mental illness.
Yeah, so really 1 in 7, so I mean, all of us at one point probably know somebody that has suffered from postpartum depression.
Absolutely.
But it is the 80% that actually suffer from the baby blues, which is different from the postpartum depression.
That's right, because postpartum depression, or the baby blues, happens when your estrogen levels and progesterone levels just drop after having the baby, and your body needs to acclimatize again, right?
Correct.
And do you think that exercising, increasing your serotonin, will alleviate some of those symptoms, because that helps with postpartum?
Absolutely, but not all women can do that right away. You do need the recovering, and it all depends what type of birth there was as well. So you can't always become as active as you'd like to be, which is how doulas come into play.
That's right. But you know what, being active, I think being active when you're all, like, through your life, and active doesn't have to mean like going to the gym or playing volleyballing your head or standing on your, doing cartwheels or anything. That can just be going for a walk, a brisk walk, something just enough to get your serotonin levels up. And I think a lot of people don't get out and do that. And do you think that a lot of women who suffer from postpartum also are a little bit alienated? They don't have a lot of support. They don't get out as much.
There's a lot of factors that can contribute to having postpartum depression. If you don't have support from other family members or a supportive husband, or if your birth, a lot of women like to do a birth plan. Well, not many births actually go according to your plan.
No.
So you could be setting yourself up to have postpartum depression. So there's a lot of things that can factor into that.
And we are living in a time where even grandparents that would normally be there for support, they're still working. And we're just so distant from each other. So that is another reason that postpartum doulas are so important, especially to the postpartum depression, those at high risk.
That's right, because so many women have such high expectations.
Yeah.
You want to have this baby, you want to have everything done properly. You have people coming over to your house. You want to have your house beautiful. You want to have your baby all decked out in great clothes and be like the happiest person in the world. And you're by yourself, so you can't do it all by yourself. And it is a change, because you can no longer sleep in. A lot of times women, especially who are nursing, may have to be up every 2 hours, and that's a lot.
Yeah,
right?
That's right.
And if you don't have a supportive partner or husband or any other family members, you can feel really lost. So in this way, how does a doula help?
Do you want to talk, because you just had a doula?
Well, for nursing, especially those who are at high risk, but postpartum doulas aren't just for them. I believe that a doula, every woman deserves a doula. So if you are nursing and you're at high risk, there is like overnight postpartum doulas that can be there basically doing everything except the actual nursing. So that gives you a little bit more rest, because normally you'd have to change the baby and get them back to sleep, and a postpartum doula can help them learn a better sleeping pattern, self-soothing methods too, and then that way when you are ready, when you are recovered, you can fall into that pattern as well.
And especially for colic, babies who are crying nonstop, nobody plans on doing that, and then all of a sudden you're so stressed out to begin with. that can just alleviate those symptoms, right?
Part of the role of the postpartum doula is to help integrate the baby into the family, for scheduling appointments, organization, preparing meals in advance so they can just be popped into the oven, taking care of the baby just so you can relax in the bathtub or take a nap. These are things during the day. You know, they'll tend to other children if you're in the home. They may do light household chores for you or tend to the children so that you can do it. So that all that helps, and then we work our way out of a job. That's what our goal is.
Yeah, and we help with breastfeeding as well too, because it's more than just a pop the baby on type thing.
Yeah, and now there's a myth. A lot of women say, "Oh, you know what? I can't breastfeed or I can't nurse because it's just not working." Every woman can nurse. Is this true?
It's very rare that a woman can't.
Yeah, medically can't. It's very rare.
It's very common that once your body regulates and you're producing the proper amount of breast milk for your baby, you won't experience that fullness in your breasts anymore. So
oh, darn.
Nearly every woman that I have worked with has said to me, "I'm not producing milk. How do I increase my milk supply?" And I always ask them, well, what's the baby putting out? How many wet diapers? How many dirty diapers? Because you can't put out if you don't take in.
Oh,
so
this is true. It's a good indication. And if you're a new mom, you don't know any of this.
Right. So a labor and birth doula, we provide education to you beforehand, like during your pregnancy, and then afterwards a postpartum doula they're really there for the mom, but they help with infant care, you know, to teach you how to bath your baby, feed your baby, make sure everything is going okay. They'll make referrals, you know, to a lactation consultant or a breastfeeding counselor.
And they can also keep an eye on you, so if you do have postpartum that's going a little bit downhill, right, where it's getting beyond that, you can actually help them out a little bit. And there's a hotline for that, right?
Yes, we provide all the resources to them for in the community, where to go. We teach other family members or spouses how to recognize the signs and the symptoms, what to do, and also how to prevent it. Because if they have all that support, and you know, as long as things aren't going bad for them, they're a lot less likely to have postpartum depression. So it's really good for everybody to be educated in the first place.
And it's good for other people in the household to recognize what is normal and what this mother needs, because sometimes people get neglected. They just think, well, it is only the baby blues, it'll pass. And then we hear of really severe cases of the woman who drowned her 5 children with postpartum. She just was not thinking right. Psychosis, that's right.
They're perinatal mood disorders. There's several. It's not just like there's the baby blues, there's postpartum depression. There's actually postpartum obsessive compulsive disorder, postpartum bipolar disorder.
Oh,
there's several. So
and you still want to have a baby one day?
For a woman to go that extreme, it's a very rapid, striking thing. The psychosis, it has to be treated immediately, but it's very rare also. So.
Yeah, thank goodness, because that's how you remember those one in a million cases, right?
But if you know the signs and watch for the signs, which is what we do help to educate, not that we're professionals on postpartum depression, we can give the basic signs, make referrals before it gets to that point, which is something we should all be educated about.
And you know, it's nice because both of you have a really nice calming effect. So it's nice to have that within your home because it calms everybody else down. It makes everybody feel at ease, like they're doing the right thing, and because everybody's questioning, right? And so it makes you feel like, oh, I can do this, I can get by. I find that even being a new mom, just changing diapers properly can be something. And when you're nursing, it's not just latch on and then go to sleep, and it's not 5 minutes. New babies can take up to an hour on each breast, right?
Yeah.
They can, yeah.
Yeah, and it can go on for months like that.
And that can be a little bit overwhelming, but that's okay.
Yeah. Yeah, it is. And
There's
it helps
no
when you
normal,
have the support, too, to say that, yes, it's okay. There's nothing wrong with your baby. There's nothing wrong with you. You are producing enough milk. That's just the way babies are.
And another nice thing, too, about getting a doula is I hear of all these women who say that they cannot no longer nurse because their babies are tearing them up. They're actually drawing blood because they're in so much agony and it's just too much and they're getting rashes. But if a baby properly latches, there are no abrasions. It's actually very enjoyable, and it's enjoyable for the mother, it's enjoyable for the infant, and the mothers actually have a calming effect because of the chemical that is carried. The nice, I don't know what chemical it is. What is it called?
Your body produces oxytocin when you nurse your baby, so that helps with your whole postpartum recovery. It helps to bring your uterus back down to the proper size. Helps calm you down. I'm not sure.
Just a lot of things.
I'm a relaxation therapist as well, so I teach a lot of relaxation methods that you can use in coping with a baby when a baby's upset or when you're upset because your baby's upset. So breastfeeding is very beneficial to a new mom and to the baby, just because it's a physiological reaction. I mean, you're meant to do it, so your body reacts.
And the ones that are normally like bleeding and having those problems, it is usually because of the latch. I always remind myself it's breastfeeding, not nipple feeding, because a lot do just latch on to the nipple. And, you know, as lactation, there's lactation consultants. We're also trained in breastfeeding as well, too, and we can help you get that proper latch so that if you don't want to, you don't have to resort to formula.
Oh, very good. I'm just going to go into a matter of fact. This is where we discuss something that is really interesting, and it's just kind of a fact that you might want to know, right? So, do you know that after you brush your teeth and you have a drink of orange juice and you get that really bitter taste? Do you know it's not actually the orange juice that is bitter? It's the lauryl sulfate that mixes with the orange juice and chemically wise and creates this bitterness. The lauryl sulfate is the same thing that froths up your shampoo and that froths up our toothbrush. And that is what causes that bitter kind of reaction. So it's not the orange juice, it's the lauryl sulfate, and it kind of makes me think like, we're brushing our teeth with lauryl sulfate? Yeah. Really? I don't even want to go there. Yeah, exactly. Thank you everyone for watching Knoxstrom Digital Media. You can like us on Facebook. And if you'd like to advertise, you can advertise right here and you can like us on Facebook and find out some more information, or go to our website, www.knoxstromdigitalmedia.com, or just knoxstrom.com, NOXTROM.com. Ziplash, we had a show for Ziplash, and they did my eyelashes, and I haven't worn mascara in probably about 4 months since I've had them done, so I really, really like them, and they're going to be moving on to a bigger location on Howard Avenue. They just keep growing and growing and growing, and they're kind of like our little movie stars because they were on the Dragon's Den over here. As getting back for the ingredients, it just makes me cringe in formula. Like the first ingredient is corn syrup. And the second ingredient, milk protein isolate. There's like, you know what? There are some vitamins in there, I can see. But you know what? There's a lot of chemicals. Did you know that the first ingredient in baby formula was corn syrup?
No, I did not.
It's kind of not really what nature intended for us, is it? No. And then we kind of wonder why we have such hyperactive babies and they're growing and growing and growing. Because one of the things that for adults is they want us not to have things with corn syrup. So it's amazing that they put that into a growing little person. Now, there's also a misconception that a lot of women say, oh, I can't nurse because my baby's so hungry and she's starving all the time and it's not enough, so I have to give her formula because I'm not producing enough milk.
Babies go through growth spurts about 2 to 3 weeks, and again at 5 to 6 weeks, and then again at 3 months, and then again at about 6 months. So many women don't know that if they're not educated on that, and the baby will want to cluster feed, and that's just the baby's way of trying to build up your supply. If you feed on demand for those, couple or few days.
And what is demand on demand? Because a lot of people don't realize what feeding on demand is, because again, you can't be OCD and think you've got to feed like every 2 hours and set your clock, or every 5 hours. On demand means
watching your baby, not the clock. So there's hunger signs and cues. Crying.
Oh yeah, crying, screaming.
Crying is actually the last sign that your baby is hungry.
Really?
Yes, the baby will.
I didn't know that. Did you?
I know that at all.
No.
So, and once the baby gets to that point, the baby's going to be swallowing gas or air, which is creating gas from crying. They're frustrated. You're going to have a hard time getting a proper latch, which can cause the nipple pain. And sometimes they just don't. They're just frustrated, and then they're getting tired too, so they won't get a full feeding because they're tiring themselves out crying. So you want to watch for a baby when they're doing this. That's their rooting reflex. If they're trying to put anything in their mouth, put their hands in their mouth. I'm not sure what other. So, I mean, as a mom, you just kind of pick up on it when you've had 4 or 5 kids, but
yeah, and it's different when you're right there with the baby. You learn to look for those signs. I guess a little bit of fussiness, but yeah, by the time they get to the crying point, they're beyond hungry, and it's difficult to feed them at that point.
Then you're going to be getting into feeding your baby every 20 minutes off the breast, and they want to go back on because they didn't get a full feeding because they tired themselves out or for whatever reason. So you really want to get to feed baby before the crying begins, and make sure that you're emptying one breast before you move the baby to the other breast so that they're getting enough hind milk, which is the fatty milk. It's going to keep them full. And then you start on the other side afterwards. You can offer the second breast, but you start on that one afterwards. So it's just making sure that you're not rushing. You need to relax. You have to have a drink every time you nurse your baby.
Not a martini, by the way.
Well, water.
Actually.
No, definitely drink a glass of water every time you're nursing your baby. Snack,
Yes.
just to make sure.
And there's certain foods that can actually cause your baby to form gas, right? Do you be careful of, or it depends on you?
It depends on you. That's
a matter of chocolate.
It's a matter of opinions. I mean, I'm a breastfeeding counselor as well, so what I was taught is that that's just what people say. They believe it's a myth.
Okay.
But I know some people who have cut milk out of their diet because they're breastfeeding, and their baby was fussy or acting colicky, so they thought they were lactose intolerant, and then things worked out better afterwards. So I can't say for sure. I don't have the. I was just told that it's a myth.
Person to person, really.
Yeah.
Now, what are the benefits of nursing? Because a lot of women especially think, oh my gosh. Now, from a standpoint of your looks and body image, a lot of people think that they will completely change, that nursing will impede their looks.
Nursing
under their shirt.
It can enhance some women.
Well, you're going to fill up with milk because your body's meant to breastfeed. So if you were going to have loose skin afterwards in your chest, it's going to happen either way, maybe even more so, in my opinion, if you don't breastfeed, because you're going to get extremely engorged before your milk dries up, and then you're stretching the skin anyways.
That's true, it's painful.
But breastfeeding is actually going to improve how your body looks because you're burning twice the amount. No, it's more than that. You're burning a lot more calories.
Which means that you have to take in more calories too while but not to the extensive amount.
For yourself. That's another thing. People, like the husbands, usually think, well, you don't eat enough, so baby's not going to get enough, which isn't true. Baby always gets what baby needs. Yeah. Your milk will take from your body to produce the milk, so it's you that's going to suffer, not the baby.
Well, it's amazing because you see in all these third world countries that people are still having babies and they're still nursing, and you think, how is that possible, right? I mean, like, where are you getting this from? Yeah. So the body is just an amazing thing, and I guess as the baby grows, your body produces more proteins, different things to feed their growing needs. And formula really can't do that because it's just one specific. I guess they have different.
And you know exactly what is in your breast milk.
Yes.
A mother always knows.
Mm-hmm. Whereas
you don't know when you pick up that can or ready-made formula what's in there. Now, that's not to say, though, that if a mother does choose to formula feed, though, that should be her choice.
Mm-hmm. As long as I guess the baby's bad, right?
Yes.
Don't neglect your babies. But studies have also showed that women who nurse, babies who have been nursed actually have less sick days at school, they sleep better, and they have less allergies.
Yeah, less colds and respiratory
less
infections.
asthma.
Yeah, studies do show
huge.
that.
Yeah.
And so when we're talking about nursing, what is the ideal length to nurse? Because that's kind of mixed. Some people think, well, if I can do it for 1 month at least, 6 months, a year.
The first 3 weeks is when it builds up their immunity, the colostrum. So I would highly recommend to at least do it for 3 weeks if possible.
So even doing it for the 3 weeks will make a difference.
Yes, absolutely.
Yeah, they get that colostrum.
Yeah, and we call that mother's gold.
Yeah.
Now there are a lot of women, I think, choose not to breastfeed or nurse because they're afraid that they're going to be stuck on a schedule indoors and they can't go out. But you can go out and you can live just a normal life. But Violet gave me this really interesting video. I don't know if we can play it, Alex, if we have enough time. Part of it, and it's a bit of a spoof, and it's about people who don't like nursing women in public. Do you get a lot of women who say that they're afraid of going places, or that they've ever been asked to leave because they've been nursing?
I don't know anybody that it's like, I haven't worked with anybody that has happened to. I breastfed all 5 of mine. It didn't happen, but I do hear stories a lot on parenting groups that I go on. They've
It
been
can
asked
make you
to
feel
leave.
a little bit embarrassed at first if you don't have that support around you, other people that have done it or that are recommending it, because there's a lot of people that do formula feed, and for whatever reason, working, whatever, and you may feel that, I don't know, you just might feel embarrassed.
And speaking on breastfeeding, is there any nutrients that's lost if you use a breast pump instead on your child instead of actual contact?
Well, you'll never ever get as much milk by using a breast pump. Even the ones at the hospital, you won't be able to get the same suction as you will from the baby. So you will lose hind milk, but you're going to get a lot of the fore milk when you're doing, and that's where all the fat, they need all the fat for their brain to develop. So yeah, you would lose that if you strictly pumped.
But it would still be more beneficial than formula feeding in the beginning, at least.
If you had a really good pump.
Yeah, a really good pump.
Yeah.
What about ladies with inverted nipple? They cannot breastfeed.
Yeah, that's right. I never even thought of that. Ladies with inverted nipples,
They can breastfeed.
they can breastfeed.
Yeah, some people have flat nipples and they believe that they're inverted when they're not. True inversion, they're visibly inverted, and there's like
Nipple
suction
shields?
cup thing. There's like suction cup things that you use to pull them out, and then you would wear a nipple shield afterwards. So it would be more. You'd have to be very dedicated to do it, but yes, women can.
Yeah, there are artificial nipples that you can use, and it'll still suction the milk.
Okay, another question. There's a lot of women now, because the trend is a lot of women were getting breast augmentations. Can you nurse if your breasts are augmented? If you have implants? Nobody knows what that means.
I can't answer that. I've never worked with a woman who had implants, and it's never come up in my schooling. I don't know. Do you have any answer
I do
for
know
that?
somebody that did, but because she wasn't a client, and I don't have that personal information or the authorization to speak about, I don't know how she did it. But I do know that it's possible.
What I would assume that it depends on where the incision is done.
And what
because if you're removing the areola, I think that would sever.
But the implant will block
I
the
don't
ducts
know.
back, or because your breasts fill up with milk and they grow so much too. So I don't know. Is there any more room in there for them to grow?
It would be something that you would have to discuss with your doctor prior to it, or even after, if you decide to have a child and want to breastfeed. That's something you'd need to speak with your doctor and probably be referred to a specialist. Yeah.
And So if someone wants to go, like post doula, so not with the birth, but she wants to use you as a nursing counselor, how often do you do that? And
Are you talking about just breastfeeding counseling or
Yes.
postpartum doula?
a postpartum, like both. So
Okay.
breastfeeding counseling, like do people just like call you up for that? Because a lot of times now you're out of the hospital in a day, and so you've just delivered your baby in your home. You're going home like now what, right?
I don't.
There are some that do call just for the
They'll
postpartum
call a
doula.
postpartum doula for just breastfeeding.
Not just for breastfeeding. Usually
Yeah, I
they'll call a
didn't-
specific lactation consultant. Usually one that's been recommended by the hospital if they're having difficulties.
Or the leash league leader.
Yeah.
So for postpartum, how many hours do you usually spend with them in a day, a week, or it depends on their individual?
The client defines our job.
Okay.
It's totally up to them, and we base everything around what their needs are. So it's, again, something that we can't really give an answer to.
Yeah, because not everyone needs an overnight, or they may just need a few hours a week or one day a week. So it's really their family's needs.
Okay. Should we play that video? Alex, how much time do we have?
Like 10 minutes.
10 minutes.
Do you have the video?
So what would you do
screen?
in the video?
Ready
Yeah.
screen?
Oh, it's gonna go. I'm just gonna put it on here, sorry. Violet sent me this video, and it is.
Go up a little bit.
Can you make it here?
It's Saturday afternoon in Bay Ridge, Brooklyn, and this woman heads to a local cafe to relax with her baby. She orders a coffee and then starts to breastfeed. This maternal act, however, does not sit well with Tom, the cafe manager.
Oh, God! Oh, excuse me, could you please do that somewhere else?
Are you kidding me?
Yeah, I mean, if you could, I don't want to be rude about it, but if you could please, geez, I'm trying to run a restaurant here.
As you'd probably guessed, the manager and our nursing mother, Tracy, are both actors. Tracy's baby, it's actually a doll. We wanted to see what customers will do when the manager tells Tracy that breastfeeding is not allowed at his cafe.
Yeah, I mean, seriously, whipping out your hooters here in front of the whole restaurant here?
My
I'm trying to run-
hooters? I'm feeding my baby. Do you mind?
Actually, our first couple of the day does mind.
I think she's holding this. I wouldn't have been possible.
Right, exactly, this lady
I'm
has to class. What can you
surprised.
class like this lady over here? Look at that guy, he's uncomfortable, he can't make eye contact with you.
Because you're loud.
Well, it doesn't offend me, but it's definitely make that comfortable.
It makes comedian Bill Maher uncomfortable too.
Breastfeeding a baby is an intimate act, and I don't want to watch strangers performing intimate acts. At least not for free.
I don't think I like him anymore.
In fact, according to Baby Talk magazine, 57% of Americans disapprove of public breastfeeding.
She could feed it somewhere else, feed it at home.
Actually, what you're telling her is against the law.
What do you mean it's against the law?
Yes, against you are anything law. You can breastfeed your child in public anywhere you want to.
She's right. In every state besides Idaho, Nebraska, and West Virginia, it's legal for a woman to nurse her baby wherever and whenever she wants. Still, acts of hostility against public breastfeeding are often in the news.
A Burlington mom just wanted to breastfeed. The store told her, take it to the restroom, lady.
Julia Taylor, a real-life mom, encountered that kind of hostility when she says she was ordered to stop breastfeeding her daughter in a New York City cafe.
And I wouldn't stop. And she said, I want you to leave. Leave right now.
What were you thinking?
I was nervous. My heart was racing. I couldn't believe that this
We'll just watch one more minute and then we'll.
Taylor did leave, and she's now suing that cafe.
I don't really want to be working and seeing her boobs, all right? This is
Back in Brooklyn, our manager continues to harass our breastfeeding mom.
I want to have other customers here too.
I paid
Yeah.
though. I paid for something.
Exactly, you know what? And if you want to put milk in everyone else's coffee, that's fine.
You're crossing crossing the line here, sir. She got the point. Stop.
Most customers reacted just like these women. But what if our mom is African American? After all, we're taping in a neighborhood in which 78% of the people are white. To find out, we hire another actress, Bianca.
Maybe if we set the bathroom up for you or something?
Set the bathroom up?
Yeah. I don't want to be seeing your jugs at work, all right?
Jugs? These are breasts. I cannot believe you.
Nor could some other customers believe what they were hearing.
Sir, is this making you
The conversation is.
And how about this UPS guy?
Sir, you see, does this bother you? Would you want to buy one?
Anyways, that was just a little bit of it. And we're crediting ABC News for that. That is not ours. That is not ours. But that just gives you a taste of what some women have to go through. Weren't you shocked that 57% of people actually regard nursing as something obscene?
In public. Mm-hmm.
Yeah, I was very, because a lot of times you're covered anyways. Yeah. And what do you, I mean, that's part of life.
I always had a blanket or something I would throw over the baby and myself, and I mean, I didn't do it right in the middle.
No, exactly.
Of everybody. I would sit off to the side, but I mean.
Do you know what, in all honesty, I was telling Violet, when I had my baby, we'd be in Montreal taking vacations, and we'd be out in the summertime, and I always had like little dresses that had things on, and I had a blanket, and I'd walk, and I'd shop, and I'd do everything with her. I would still live my whole entire life. And you know what, nobody gave me a second look, nobody gave me, right? I had her covered, we're fine, and I am very proud that I breastfed, and I did it for an extended time, and I have no regrets. And I had a great experience, and I think that every woman who gives birth should at least try.
I always used well, for my last two, not always, but wrap sling. So you can walk and breastfeed hands-free.
Oh, nice. You should actually make those and sell those.
There's another doula in the city that does that, actually. Yes.
And now, because you are also a hypnobirthing practitioner, do you ever practice hypnobirthing practices on women who are going through postpartum to ease them, or who cannot successfully nurse?
No, I'm not a hypnotherapist, so I can't do, I can use hypnosis for sadness, but not depression. So anything that has a clinical diagnosis, I can't, because I'm only a hypnotist.
Okay.
But I would refer them somewhere.
I just wanted to go on one last thing. Is yoga, and I noticed that in your website that you recommend that. So Mommy to Be Prenatal Yoga at Eastside Yoga Studio. Jane does prenatal yoga, which is really great for stretching out your ligaments and also keeping you relaxed and calm, because there's a little bit of meditation. And she has a 4-week session that's ongoing, and it's $60 or $17 a drop-in class. And then she has Mommy and Me yoga classes as well, and that's on Tecumseh Road East. And our own Canadian, Mike Cervini, is going to be at Music Week Wednesday, May 7th at 11:30. His concert is free, so if you're in Toronto, please go and support him. He's really, really a fantastic artist. And also, I just want to bring up happy anniversary, Snapped. There we go. Snapped actually celebrated their first year anniversary at the Spruce Wood Golf and Country Club, and Jeff Casey actually treated everybody to a great pasta, dinner, cakes, all kinds of activities for the kids. So congratulations, it's a great newspaper. It's all fun and full of community events. So Janine, Rachel, it was so great having you on. I learned so much.
Thank you for having us.
And again, so if anybody wants to find you, they can go to birth@amothersblessings.com. Is that the right one?
Oh, that's our email.
Your email, sorry. www.amothersblessing.com.
Or on Facebook, Windsor Childbirth.
Yeah.
I didn't know that. Okay.
Page will come
Is that a new one?
No, I've had it.
Okay.
The same time.
So it's Windsor Childbirth. You're watching Betty on the Go. Thanks so much for joining us. Have a great weekend. And guess what May 5th is? Cinco de Mayo. So have a great time and celebrate, Alex. Arriba!